Okay, so Mr. and Miss Teal, I'm going to ask y'all a few questions about Blakely's health history. So has she ever had chicken pox?
No.
Has she ever had rheumatic fever?
No.
Has she ever had arthritis?
No.
Cancer?
No.
Scarlet fever?
No.
Pneumonia?
No.
Tuberculosis?
No.
Diabetes mellitus?
No.
Heart disease?
No.
Kidney disease?
No.
Hypertension?
No.
Jaundice?
No.
Okay. So has she had any surgeries?
No.
Okay. Has she had any serious injuries like being in a car accident or falling off a slide or anything like that where she's gotten hurt?
No.
Okay. So this is more for Tori to answer. So this is the prenatal history.
Okay.
So how many pregnancies have you had?
2.
How many term deliveries?
2.
Any preterm deliveries?
Oh, I'm sorry. So Blakely was 39 weeks and Whit was 38.
38. Okay. So that still wasn't preterm, so no. Any miscarriages or stillborn?
No.
Number of living children?
2.
Okay. So when you were pregnant with Blakely, did you take any medications?
Just prenatal vitamins and iron supplements.
Okay. How would you describe your diet?
Just a normal diet. I didn't do much different.
Okay, like 3 meals a day?
Yes, probably. And then probably like an extra snack.
Okay. Did you have any abnormal bleeding?
No.
Do you know your blood type?
Nope.
If you don't, that's okay.
I don't.
Did you have to have a blood transfusion?
No.
Okay. So that you said that was okay. What was your type of delivery?
Vaginal.
Okay. Length of hospital stay?
2 days.
Did you need any oxygen following your delivery?
No.
Did you bottle or breastfeed?
Breastfeed. And bottle. Both. I make sure both.
Okay. Did you have any feeding problems?
No.
Okay. If you don't remember, that's okay. But do you happen to remember Blakely's birth weight? Or around?
6 pounds, 14 ounces.
Pounds 14. Okay. And do you happen to remember how long she was?
19 and a half inches.
And a half. Okay. And so this next part is her developmental history. So this is like what age she was when she did these certain things. And if you can't remember the exact, that's okay.
Okay.
Okay, so do you remember when she was weaned from breastfeeding? Around the time?
1 year exactly. Like 365 days.
Okay. Do you remember around the time that she started to smile?
Probably.
In between 4 and 6 months.
No, not smiling. Smiling's like probably like 2 months.
Okay. Do you remember around the time she started turning over?
Probably about 3 months.
Okay. What about when she started to sit, like hold herself up by sitting?
So right at 6 months.
Okay. What about when she started crawling?
That was probably more like 9 months. Yeah.
Okay. When she started walking by herself?
13 months. So right over a year, 13
Okay.
months.
Her first tooth?
Probably about 6 months.
6 months. First word?
Dada.
Dada. Do you remember when she said it to you?
I don't. What would you guess? When did she start talking? Probably around like 10 or 11 months.
Okay. And so she's worked, is she already toilet trained or is she working on it?
We're kind of working on it, yes.
Working. Okay. So comparing Blakely and Whit, Are they pretty much going about the same when they started like experiencing everything?
Yes, for the most part. We have noticed Blakely sat up probably a little bit faster than Wit, but they're about around the same.
He was
Okay.
rolling over before she did.
Okay. So, if you evaluated Blakely's health and development, would you say that y'all had any problems, like with her health, like with being sick or anything a lot?
No.
Okay. How are her sleep habits? Where does she sleep? How long does she sleep? And are there any issues?
No, she's actually a pretty good sleeper. She sleeps in her bed. She naps at school on a cot, and then she sleeps from about 7 p.m. to 6 a.m.
Okay.
And she naps 2 hours in the middle of the day, usually from 12 to 2.
12 to 2. Okay. And how is her appetite?
Body.
Yeah, she's on the smaller end of her age.
Okay. So this next part, and if you don't remember, that's okay, so we'll skip it if you don't. But do you happen to remember any of her, if she's up to date on her immunizations?
She's up to date on everything.
Okay.
So whatever they give up until she's 2 years old, she's had.
Alrighty. And for her screening test, did she get her screening test done when she was born? Like,
Yes, like her hearing and
yeah.
yeah.
Yes.
And then they also did it at school.
Done at
They did an eye test at school recently.
Okay. So how often does she get any health exams done?
Just whenever she's supposed to go to the doctor. She had a 2-year-old checkup when she turned 2, and then she doesn't go back until she's 3, unless she has to go for being sick.
Okay. And how often does she go to the dentist?
Every 6 months. She's been once, and she was supposed to go, but coronavirus.
Yes. Miss. Okay. Has she gone to any other visits, like to get her ears checked or anything like that?
We've been to an ENT to get her throat checked.
Throat check. And why did y'all have to go do that?
Because she has that
And enlarged.
epiglottis.
Okay.
And she has very large tonsils.
Large.
So we were just getting her checked.
Okay. All right, so this next is like a systems review section, just kind of asking if she's had any of these certain issues. So has she had any weakness, changes in her weight or appetite, or any sleeping difficulties?
No.
Okay. Has she had any itching, any ulcers or rashes, unusual hair growth, changes in texture of skin?
No, not other than just like a diaper rash.
Okay. Then, does she have any birthmarks or scars?
I do not think that she has any birthmarks. Do you think?
I can't remember.
Yeah, I don't think she does.
Okay. So has she experienced any headaches or can she hear well? Does she have any hoarseness?
She can hear well. She's
Has she had hoarseness or anything?
no, and no
Okay.
headaches. I was trying to think of what.
Does she use glasses?
No,
And does she have any visual problems?
no.
And you said earlier that her tonsils are enlarged, right? Okay. So this next is respiratory. Has she had any coughing?
Just seasonal coughing
Seasonal.
with a cold or.
Yeah. Has she had a lot of like mucus?
Yes, just seasonal too. Whenever she has a bad cough, she'll have mucus.
Have you ever seen her like wheezing or having shortness of breath?
No.
This next is cardiovascular. So does she have any murmurs or palpitations that y'all have noticed?
No.
Okay. This next is GI. So does she have any nausea or vomiting or diarrhea?
She has had diarrhea before, but it lasted, I guess, like a month. And we put her on that, kind of like that brat diet. And they called it cobbler diarrhea, I think it's what they call it.
Cobbler diarrhea.
Yeah, I think that's what they
Has she had any constipation?
She has before a little bit, but not bad.
Okay. Any food intolerance?
No.
Okay. Any hemorrhoids?
No.
Okay. Has she had to use laxatives before?
No.
Okay. So for you said that she has had diaper rashes in the past.
Yes.
Has she had any abnormal bleeding or discharge?
No.
Okay. So for musculoskeletal, does she have to use any assistive devices to get around?
No.
Okay. Does she have any stiffness or aches?
No.
Okay. All right. For neurological, has she ever fainted before?
No.
Okay. Any dizziness?
No.
Any tremors?
No.
Okay. Any seizures?
No.
And any loss of consciousness?
No.
Okay. So for lymphatic and hematologic, has she had any abnormal bruising?
No.
Okay. Any lymph node swelling, like swellings in her neck? Okay.
Not that we've ever known of.
Okay. Or any excessive bleeding?
No.
Okay. And then for endocrine, has she ever experienced excessive sweating?
No.
Any intolerance to weather changes?
No.
Increased urination?
No.
Increased thirst?
No.
And has she had any thyroid problems?
No.
Okay. So this next part gets into like family history. So this will be both you and Bubba, you and William.
We're terrible at this.
Oh, that's okay. So do any of your family members have a history of heart disease?
Yes.
Okay. Any history of tuberculosis?
Yes. For you too, because your dad.
Oh, yeah.
Your dad had a heart attack.
Okay. What about tuberculosis? Any family history?
No.
Okay. What about diabetes?
Yes. On both of our sides.
Yes.
Okay. What about cancer?
Yes.
Okay. Tori, do y'all have cancer on y'all side?
No.
Okay. What about kidney disease?
Not that I know of.
Right. Okay. Nope. Okay. Any blood problems? For like, I guess this would be like more if you had like sickle cell or
Oh, no.
any like platelet problems. You know. Any mental illness problems?
No.
Okay. So this next part is household members. So will y'all list me who all lives in your house and how old they are?
Yes, we have Whit. He's 6 months old.
Okay.
Blakely is 2.5.
Okay.
I'm 27.
Okay.
Yes. And I'm 29.
Okay. All right. And this next part is about y'all's health. So, William, you said your age was 29.
Yes.
How is your health status?
Good.
Okay. And Tori, you said you're 27.
Yes.
And how's your health status?
Good.
And then Whit, y'all said he was 6 months.
Yes.
And how's his health been?
How in depth does it need to be?
Have y'all had any problems like recently with him?
He,
He's wheezing.
yeah, he's had wheezing.
He was diagnosed with parrot influenza. Stayed a night in the hospital.
Stayed in hospital. Okay.
And he just has wheezing that we monitor.
And so this next is nutritional. So how would you explain Blakely's diet?
I mean, she eats. I mean,
Yeah,
she eats most
when
of
she's
anything.
hungry, and
Yeah.
she eats.
She
Yeah,
eats
most
well.
of anything.
Okay. Does she like to eat vegetables or?
Yes, she
Yeah,
likes
she
broccoli.
eats.
Okay. Does she eat fruit too?
Yes.
Is she on any supplements like iron or vitamins?
No.
And you said her eating habits were good. Does she take any formula, breast milk, whole milk, or other?
She drinks whole milk.
Whole milk. And how would you explain her average day activities?
Oh, she's very, very active.
Does she play a lot?
Yes.
Yes.
Play.
We like to play outside.
Okay. Do y'all have any special cultural practices? Like any special religious practices?
Other than attending church, no.
Okay. And do y'all have insurance?
Yes.
Okay. Would y'all say y'all have very good physical family coping and psychological family coping
Yes.
Yes.
with the problems? Yes. Okay. And that is. Oh wait. Is Blakely on any medications?
No.
Okay. And has she had any X-rays done?
No.
No.
Okay. And has she had any lab tests done?
No.
Okay.
No.
And that is. Oh wait. Okay, you told me that. All right, and that's it.